Welcome everyone to Lakeland Health St. Joseph Emergency Department. My name is Michelino Mancini and I am the Emergency Medicine Residency Program Director. It gives me great pleasure to give you a tour of this unique emergency department. We have 40 beds in our emergency department. We have 6 beds that are designated for observation. These are patients that require chest pain rule-outs, congestive heart failure, COPD, and IV infusion. These patients are situated here for 24 hours so that we can continue to give care here and continue to provide acute care to those in our mainstay emergency department. The care provided here is provided by our residents and our faculty, and we have designated nursing staff that are here 24/7 to continue our protocol-driven order sets that allow our patients to efficiently be discharged home. Next, we have beds 29 through 34. These beds are open over 12 hours a day for our fast-track patients. Again, lower acuity patients, but does provide a significant amount of flexibility for patients that may have higher acuity. Our fast-track patients can quickly be seen, part of the normal ED stay, and then quickly disposed home. In our main portion of our emergency department, we have beds number 10 and 11. These beds are specific to our psychiatric patients. Our psychiatric patients are seen by us, provided medical clearance, and then we have others, our psych navigators, who are able to determine placement. They may be placed at our facility or at other facilities. And we do have care management present in our emergency department that helps to provide us another means to decipher any patients that might have social issues or other issues that are outside the realm of medicine. As we are walking towards the trauma bays, we have 2 very large trauma bays that are able to house 4 patients. These trauma bays have equipment that's fully stocked to provide care to a multitude of trauma victims all at the same time. Within our trauma bay, you have equipment such as our ultrasound machine. We have 3 ultrasound machines in our emergency department. We at Lakeland Health love using ultrasound and providing point of care ultrasonography. In addition to that, we have our STORS machine. Our STORS machine allows us to provide fiber optic intubation or difficult intubation as needed. In all of our rooms, we have a designated computer that allows us to put order sets in and provide documentation as we are seeing patients or following through with patient care. Finally, in our trauma bay, you also see a neonatal resuscitation that allows us to provide neonatal resuscitated trauma victims and non-trauma victims, which is our PANDA unit. As we continue to walk in this direction, you will see that we have our triage and our waiting room situated right in front of us. And our next rooms that we'll look at will be our sexual assault nursing examiner rooms. We are one of very few institutions in the state of Michigan that has a sexual assault nursing examiner room. These patients are seen privately and then medically cleared by our physicians, and then our nursing examiners come in and continue the detailed and longer patient care that's required for these individuals and needed for these individuals. Also in our emergency department, we have designated diagnostic suites both for x-rays and for CAT scans. Our x-ray techs and CAT scan techs pick up the patients, bring them here, and can quickly provide these radiological images for us to provide efficient flow of patient care. Again, when you think of our emergency department, we are very efficient. We do not have overcrowding in patients in our ED. And the real reason that this works so well is the collegial environment that occurs within the brain of this emergency department. As you see behind me, we have our nursing staff that is situated very close and convenient to our residents and our physicians that are located in the same arena. This area allows for quick, flexible communication and allows for proficient disposition of all of our patients. Right in front of our residents and faculty are our clerks and ACCs. They are able to perform a multitude of different tasks, which again allows us to be very proficient in our disposition. As we finalize this tour, I want to highlight our flexibility in care, our adaptability in care, and this collegial atmosphere that allows us to provide quick disposition, effective disposition, and great care to every one of our patients. I'm so happy you spend time with us on this tour. We hope to see you at Lakeland Health, and we hope to be able to train you in the near future. Thank you so much.